so nervous for this interview. I've heard nurses eat their young. What kind of questions are they going to ask me? Hope I didn't get too dressed up. What's going on, guys? Welcome back to A Couple Nurses. It's Cordero.
And your girl, Monica.
And then today we're going to make a video that people have been wanting for a long time, and we finally got around to making it. And it's about how to prepare for an interview and pretty much all facets.
Questions that we gathered from nursing students right now that are finishing their capstone, about to interview for their first time jobs, or either just started their nursing program. And we also gathered facts from people that have personally interviewed us. So I think this video is gonna be really helpful on killing that first interview or second interview that you had on getting your dream job and starting your career off as a brand new baby nurse. All right, guys, the first question that we have for y'all is what to bring to an interview. Cordero?
What to bring to an interview. So first off, I say bring your full self.
100%.
You gotta shake your nerves out. Of course, it's gonna be nervous. It's your very first job. But know at the end of the day that you have to be genuinely yourself. You can't try to be someone that you're not. And I feel like interviewers can really see that when you're trying to fake it.
You guys have to remember, these people are people, okay? They can sense the bullshit that you're presenting to the table. So like Cordero said, just be yourself, but also present yourself in a professional demeanor.
Another thing you wanna bring is a portfolio or professional folder.
100%. So Dero had taught me this. He bought this little portfolio from any convenience store that you can find. So what the portfolio usually contains is, for me, I think it's a really good secret to keep 10 resumes, 10 cover letters, and maybe have a little piece of paper printed out with questions that you would like to ask the interviewers. That's always very important, into asking them questions at the end of your interview. Never say you don't have any questions. So not only are you interviewing for this position, but you're also interviewing your employer. This is your license on the line, and you want to make sure that you're getting taken care of. So always have at least 3 to 5 questions handy for the end of the interview. Another thing to bring to the interview is dress to impress, guys. That's super important. Do not show up in scrubs. They don't care. They don't care if you're a tech. They don't care if you have any other job responsibilities or duties throughout that day. Make sure you dress to impress. Okay, guys, this is your first job that you're gonna be having as a new graduate. So it's very important to show that you care with your attire. No low-cut shirts for girls. Make sure that your hair is well groomed, not overpowering makeup. Take those little things into consideration.
I would say for guys, for my first interview, so I had a full suit. I had a dress shirt underneath, had a tie with my little tie clip, had a fresh haircut, groom yourself up, make sure you look good, make sure you smell good. And then for my second interview for the next job that I had, I loosened it up just a little bit, so I still had a suit on, I just didn't have a tie. But I think the tie does bring another demeanor and makes you look a little bit nicer.
All right, guys, this next question that I feel is super popular in interviews, especially as a new graduate or really any position, is the icebreaker question. Tell me a little bit about yourself. I absolutely hate this question, but sometimes you need to use it as your best advantage. Me personally, every time that I've done it the way that, with my strategy, which is basically answering any and every possible question that you think that they may ask you. This isn't an opportunity to talk about your dogs, to talk about your family, to talk about anything that's really not related to the work field. You may think so, but it's not. It's an icebreaker question. It's for you to let loose and for them to really get to know you and your personality. Always remember, keep a professional demeanor, smile, and make sure you're making eye contact with everyone on the table and in the panel. So for me personally, whenever they ask me, tell me a little bit about yourself, I start off with my name, when I graduated, that I passed NCLEX recently, especially for your new graduate positions. Also, I just kind of tell them, now that I've gotten a new job, side note, I have told them about the past experience that I've had in my last year, and I kind of wrap around what I did on that unit. But for you new grads, I kind of use that opportunity to shine. I made myself shine at that point. I talked about how I graduated valedictorian, top of my class, all my honors, my volunteer experience, my global health education experience. I made myself seem like the total package, and that's okay. This is your time to shine and to make yourself seem like you're the best candidate for this position. You talk about your grades, you talk about all the opportunities that you've had in your clinical experiences. Sometimes I like to throw in a few of my clinical experiences that stood out to me and why I want to be a nurse. And sometimes I even throw what are my weaknesses out there and what are my strengths as well. And then we'll also get to another question that deals with how to answer those weaknesses. So make sure you stay tuned for those as well.
How I answer that question, tell me a little bit about yourself. I really want my employer to get a good feel about who I am. So I really want them to understand how tenacious I am and how much I'm willing to learn, how good of a team player I am, how good of a leader that I'm trying to develop into being. So these are things that I really want them to see. What are my core values and all the things that I've done to get where I'm at right now. Like Monica said, if you do have any clinical experience, it's definitely something you want to include in there.
Also, Cordero brings a huge point. We are different in our academic journeys. So something that he likes to throw in is he played, professional football. He's absolutely right with how he said, even though that we have different academic journeys, that still doesn't make you less of a candidate for this. So for example, Cordero always likes to use his college football experience into his interviews, and that kind of shows that he's a team player. He was captain for his team his senior year, things of that nature that make him seem like a leader in a role, and that also puts you in an opportunity to grow within the company as well. So really utilize your personal experience that you've had throughout your life, your college experiences, and anything in your past job field or school experience that has led you to this point right now, and that makes you a really good candidate for this position. With that being said, also whenever they ask you, tell me about yourself, and you're wrapping up your interview, I also like to take into consideration sharing the values that I have as a person and the values that the hospital or the employer has as well. And I kind of like to mesh those together to make them seem like, hey, this person studied the hospital, she studied this position, she knows our core values and our mission statement, and she's able to formulate that into the way that she carries herself in her day-to-day experiences and how she's gonna care for her patients.
That's big time.
Another good tip when they ask you the question, tell me about yourself, is during your clinical experiences, especially as a new graduate, or even if you have previous experience, you can say, I really learned during clinicals or during my past experience on when to be a leader and when to be a follower. That tells them that you know when to stop, you know when to ask questions, and you're being a safe nurse. And you also know when you have to step up to the plate and it's your time to shine because you're the one that has the knowledge base in any scenario. So this is something really good to share with them. Try to think of a clinical experience when you acted like this, because they will ask you, well, tell us about a time that you acted on something like this. So I feel like that's one of the greatest statements that you can really make in an interview. All right, guys, so a lot of questions that I'm getting right now are tips for students who have no PCT experience, or tips for students who, this is their first career in the healthcare. So I like to personally say I did have some tech experience only for 9 months, and it was honestly the perfect amount of experience that I ever needed, because they saw that, hey, this person's not awkward around patients. She knows how to clean butts and she knows how to take vitals. Honestly, that's what it shows. And I'm not saying or downgrading techs at all, because I was one before, but what I am saying is you don't necessarily need tech experience in order to become an ICU nurse or any nurse that you dream to be. If you've had any other career paths and this is a 360 turn for you and you're coming into the healthcare field, you gotta utilize all those experiences that you've had in your past careers and kind of utilize that towards your new career. If you were a server or a bartender or working in some office, you use those customer service experiences for this new opportunity that you're about to do. And that's a way to also brag about yourself, because it shows that, you're all about customer service, and nursing in a way is serving the public if you think about it. Yeah, you're trying to manage this patient and keep him alive, but at the end of the day, you need to know how to critically solve problems and talk to human beings, and also have a compassion backbone as well. So don't think just because you haven't had any patient care experience that's going to kind of set you back for interviewing for your dream job.
I think it would come down to how to answer the questions, because a question that I think is pretty frequent is, tell me about a difficult time and how you got over it.
Absolutely.
So if you can really, whenever you get to answering these questions, it's a really good idea to paint a picture. So don't just answer the question flat out. Give a good background of the situation, why it was stressful, and how you prevailed.
That's really good. That is a common question that we get a lot too. Another question that we've been receiving is how to answer your weaknesses. So I feel like Cordero is really the genius behind this, so I'm gonna let him answer this question.
When it comes to answering your weakness, I think it's just really taking a look in the mirror at yourself and not giving them no bullshit, for lack of better words. Again, be yourself.
So usually for weaknesses is one of the most popular questions that we get all the time as far as your interview tips. For me personally, I like to put something out there that's a little bit bad, but not bad enough to make them think twice about you as a candidate. So for example, one of my popular answers I always utilize is, well, sometimes I tend to be a very independent person and self-sufficient as possible as I can be. Although I do ask a bunch of questions, I sometimes forget to use my resources and delegate. And that just shows that, you know, you're really strong-willed and, like I said, self-sufficient, and you're always trying to problem solve on your own, and that you forget that there's other people that are there to help you. And so, yeah, that's a weakness, but then you turn it around and make that a positive. And so that's how I think about a lot of the weaknesses that, you know, most people have, but you also don't want to make it too bad. So just watch out with that one. That one's a tricky one. What example would you have, Cordero?
I think the last time I used my drive, just how sometimes I don't know how to take my foot off the gas. I feel like I'm on go, go, go. I'm always trying to learn. I'm always trying to get better. And really, especially as a nurse, you need to have that work-life balance to where it's like, hey man, you can't be trying to learn. Like sometimes you need to chill, you need to relax, and it's really good for your mental health. So that's a weakness that, like Monica said, you can kind of turn that weakness into a strength because they know that you're driven. They know that you're wanting to be your best version of yourself. Absolutely.
I also have a friend who told me a really good one too. He told me that when he gets asked this question, he says, I'm a workaholic. I work so hard that I put in so much time into my career that sometimes I also forget to take care of myself and give myself a break sometimes. So that kind of relates to what Cordero was saying as well as his weakness. And so that just shows that you really care about your career, that you're really out here trying to grind and make the best version of yourself, that sometimes you need to tap yourself on the shoulder and say, hey, like, relax, take a day off.
Thanks.
All right, guys, a really popular question that I receive all the time: do grades matter to get into the ICU? As you can see, Cordero and I come from two different academic journeys. Cordero graduated with 3.0, I graduated with the 3.77. When I asked my interviewers after I got hired, obviously after a few months, y'all, and I got comfortable with them, I asked them, hey, why did I get selected? What are some things that you guys look at? They told me they look at how you dress. Obviously, we've already covered that. They told me that they said that grades do matter, especially for ICU. And so I was really happy that I was able to obtain those goals in order to get that position. But just know that it's not impossible. Sometimes it's about who you know and not what you know. Sometimes it's about who you know and not what you know. So it's important to make these connections early into your nursing career, and even as, you know, new graduate nurses. Even if you're in school and you're doing your shadowing experience and your clinicals, maybe if you and that, you know, preceptor vibe a little bit, ask them, you know, for tips or anything like that. Maybe y'all get close enough to where y'all exchange numbers. And so that's a very important resource to keep in the back of your pocket. Okay, guys, this is a really good question. If you can't get into the ICU, what other units should we look into? This is a really important question because depending on how you want to carry on your career journey and whatever else you want to do into graduate programs, you know, you want to set yourself up for success. So if you can't land that ICU experience, I think the best next goal for you should be a step down unit. That will teach you the ins and out of, you know, when patients leave the ICU, but they still need a little bit more attention than your typical med-surg patients. And as well as, I have a personal friend who started her career in oncology unit in med-surg. She lasted there for about a year. She didn't really like it, but she grinded it out, and then she was able to get into an MICU unit as well. Again, it's all about who you know and not what you know sometimes. So the moment that you get that position or the moment that you start your clinicals, start gathering those connections ASAP.
Would you say step down is better than like a PACU or ED?
The ED is also a good place to start your experience as well if you aren't able to land that ICU experience. I have heard that ICU and ER are one of the toughest positions to land as a new graduate as well. So you're absolutely right. If you want to go into ER, go for it. But I think, in my personal opinion, that step down would be the next best step to get in. I think that step down would be the next best step into reaching your ICU goals.
All right, guys, you're almost ready for your first interview. To finish up this video, we're going to finish up with some questions that you should ask your interviewer as the interviewee.
Go ahead.
So the question I like to ask is, what traits in a new hire do you see in me? And what this does, it's kind of like a psychological thing. It makes the interviewer look at you and really see you in the role as a new hire already. So in their brain, it's already like, dang, like, this is what I like about you. These are the traits that you have that we expect in a new hire. And I just think that's a great question.
That is a really good question because, like he said, it's reverse psychology, and then it also tells you, did I kill this interview or did I not kill this interview?
You're gonna be like, well. You're right.
All right, guys, I have 3 questions that I also have for y'all. I know we only said 2, but we're feeling real generous. So, what opportunities do I have for obtaining education/certifications? How does leadership help when the unit is understaffed or under high acuity? Also, what kind of committees are available? These questions are really intense, especially as a new graduate. If they see you asking these questions, they're like, what?
Yeah, you applying pressure.
You applying pressure. Like, they know what you're looking for as far as a, new journey for yourself, that you're taking this very seriously. So jot those questions down, surprise your interviewers, and you're gonna kill it. All right, guys, y'all are gonna kill this interview. If you have any other questions, Cordero does actually help with these questions. If you have anything further than what we provided to you, he's able to assist you in building up your resume, editing some things, as well as creating a FaceTime or Skype one-on-one mock interviews to help you land this dream job of yours. So make sure that you guys hit us up on the comments. Nurses rock. Peace out.
Peace.